What if I told you that aliens are real? Just kidding. Although we don't really know whether aliens are real or not, there is a rare neurological condition called the alien hand syndrome, which causes a person's hand or sometimes a leg to act independently of the person's control. With this condition, the affected hand feels foreign to the patient, like an alien, hence the name, and carries out tasks that are unintentional and of its own will. The syndrome also goes by the names of Strangelove syndrome, Strangelevian hand, or anarchic hand, and occurs more often in adults than in children. But what exactly causes this phenomenon? Well, there isn't one universal cause for the alien hand syndrome. It's a result of some kind of damage to the brain, causing disruption in movement and control. There are three main categories of the alien hand syndrome, depending on which region of the brain gets damaged. First is the frontal lobe. The frontal lobe carries out many functions, including voluntary muscle movements, such as moving your hand to pick something up. Damage to this lobe is the most common version of the alien hand syndrome, and some symptoms that patients may experience are impulsive groping and difficulty controlling their hand. The next version is the callosal version. This version deals with damage to the corpus callosum, which connects the left and right hemispheres of the brain, and allows for them to communicate through neural signals. Damage to the corpus callosum can often result in conflicting movements between the two hands during tasks that require their coordination, like tying your shoelaces, due to an improper communication between the two hemispheres. Finally, the posterior version. This involves damage to the parietal lobe, which is responsible for receiving and processing sensory input like touch, temperature, and pain. People with this variant may not even recognize the limb acting involuntarily as their own. Like mentioned before, there isn't one universal cause for the alien hand syndrome. However, there are many reasons why the brain can get damaged. Some of these causes include stroke. This is where the brain cells die due to the blockage or breakage of blood vessels in the brain, preventing brain cells from receiving oxygen and nutrients from the blood. Another cause is neurodegenerative diseases like Alzheimer's and Parkinson's that affect important bodily functions like heart function, movement, breathing, and balance. The third is midline tumor. And the fourth cause is an aneurysm, which occurs when the walls of arteries in the brain weaken, causing them to widen and balloon outward. Now, if you're wondering if there's a cure for this rare condition, the answer is, unfortunately, no. However, scientists are working on finding a treatment to reduce the symptoms of this condition. So, are aliens real? Well, we don't know. But we do know that the alien hand syndrome is.